Can memory and mood be affected by movement disorders? Yes, it can happen. Mood can be affected in quite a few movement disorders such as Parkinson's disease, Huntington's, some of the chorias which are genetic, which can be affected very early on. Now, memory disorders are a later feature of Parkinson's disease involvement. This is quite advanced. By the time 9 to 10 years, we think they develop dementia. The difference between the two is quite a lot because Huntington's disease, you have a lot of extra movements throughout the disease, while in Parkinson's, you can have tremor, but you generally have slowing and rigidity as the features. So memory can be affected early in Huntington's but late in Parkinson's disorder. Both are movement disorders. One extra, which is called hyperkinetic, and the other is more hypokinetic, like in Parkinson's disease. Now, there are some other movement disorders and where you can get movement disorders affected, and some of these are like rheumatic chorea and all that, you can get some involvement. What about memory? Memory in Parkinson's is a late feature, as I said already. It can happen quite a few years later, and this happens when dementia sets in, normally 10 years or more. But in some genetic variants of Parkinson's disease, such as Kupffer-Jacob, you can get it early. So these are the early onset ones. By and large, memory per se is not affected in Parkinson's disease for the vast duration of the course. Mood, on the other hand, can be affected. It can be affected by the disease itself. It can be affected by the medications that you can get. And some of these can be quite harmful, such as you can get impulse control disorders. You can get odd disorders in Parkinson's disease where you have compulsive gambling, you have compulsive investment into the stock market and losing a lot of money. You can also have this happening with medicines. It can happen also with eating, collecting things, sex. All this can affect the family a lot. So on the whole, in movement disorders, mood disorders can get affected early, but the memory per se gets affected later in most of the movement disorders, with Huntington's disease being a notable exception. Thank you.
Like, comment, and subscribe for more health updates.